I'm Georgia Cole, and I have the pleasure of chairing our second panel of the day, where we're going to move from that fascinating big picture discussion of some of the humanitarian dilemmas that are playing out in this conflict in Sudan, to really zooming in on the data that we have around the protection risks for Sudanese and third country nationals as a result of the 600 days of war. So this panel is bringing together data from across various organizations who have been mapping over the past 2 years how these dynamics are unfolding, to give a kind of comprehensive view of the protection risks that then we can carry with us over the next day and a half to inform the remainder of this conference. So going down up the line, we will have Stefan Savrimuthu, who is the Regional Senior Information Management Officer for UNHCR. Then Harry Cook, who is the coordinator of the Regional Data Hub for the International Organization for Migration. Ms. Lavina Ranjan, who is from MMC, the Data and Research Manager for East and Southern Africa, Egypt, and Yemen. And then Harriet Holder and Angeliki Karidi, who are from the Danish Refugee Council, who will be providing a joint presentation. There were a number of prompts that our speakers will engage with, such as thinking through, are there any trends that come forward by looking at the data from a regional or cross-regional perspective that we might have missed if we were only looking at country-specific data analysis? What and where and for whom do we see the greatest risks? Did that cut out? Am I back now? Or thinking from the other side, are there signs of where there's been effective engagement with humanitarian interventions? Thinking not just of where those risks are being exacerbated, but also where can we see areas where they've been particularly successful, and how can we learn from that? And then what responses do we really need to think about based on this data? So how can we have evidence-informed, empirically driven humanitarian responses? So without further ado, I'll hand over to Lavina to begin the presentations.
Hello? Good? Yeah, great. Thanks, Georgia. So as she mentioned, I am the Data and Research Manager with MMC in this region, and I'll be presenting on some of our findings. So MMC has been collecting data in Sudan and surrounding countries since before the conflict, and we were back in Sudan in August of 2023 after the war started. We have just over 2,000 surveys in Sudan, over 600 in Chad, over 400 in South Sudan, and just over 150 in Ethiopia. And in all 4 of these countries, we do direct interviews with refugees and migrants by refugees and migrants. In Egypt, we operate a bit differently, where we're tapping into a pool of beneficiaries that are part of a training program with a partner on the ground. So just zooming in on some of the profiles, in Chad, as mentioned in the earlier panel, we see really an overwhelming number of women moving with children, which really tracks with what UNHCR and other actors are reporting on the ground. The group is largely coming from Darfur and showing really extreme vulnerability. In Egypt and Chad, we see that the migrants and beneficiaries are 97% Sudanese, whereas in South Sudan and Ethiopia, we really see a mix of South Sudanese and Sudanese migrants who fled Khartoum when the war kicked off. In Sudan, what's interesting is we see that people are still migrating through Sudan, even since the war began, so it's still a transit country for Eritreans and Ethiopians, as again was mentioned earlier. So looking at onward movement intentions and feelings of safety, we've asked respondents to what extent they feel safe in their current location. That's the bar chart on the left. And then we also asked them about their short-term movement intentions. So we really see that where people feel safe, they're less often expressing a desire to move in the short term. This holds true in all surrounding countries, and it's really only respondents in Sudan that cite feeling very unsafe and therefore intending to move to another country. From a programming perspective, we think it's very important that we advocate for countries to keep their borders open. We know that if safety changes, then movement intentions will also change. There's also very high vulnerability for third country nationals in Sudan and the need for extra protection measures. So zooming in on those respondents in Sudan who said that they plan to move to another country, the map shows you that the majority are planning to move to Egypt or Libya along the earlier parts of the Central Mediterranean route. And the main preparations they say they've carried out to execute this movement plan is contracting a smuggler and arranging transportation. Now we know that smugglers can provide a service, but also sometimes they can be perpetrators of abuse. And so the journey that they're taking really brings on a level of risk and added violence. We also see that nearly half haven't made preparations yet, which could imply that there's more the idea or aspiration to move rather than the intention, or they will make unprepared journeys, which is quite risky. Okay. Looking at the routes that people take and where they experience abuses and harms, this map shows that the majority of our respondents are displaced from Khartoum, Al-Fashir, and Al-Junaina. Those in Al-Fashir and Al-Junaina fled to Chad, and they specifically mentioned their location of origin as dangerous and a reason for fleeing. Those who fled Khartoum went north to eastern Sudan and Egypt, and south to Ethiopia and South Sudan. Port Sudan, Gedaref, and Ad-Damazin were also cited as dangerous places along the journey, as well as the border with Egypt and the Sahara. The graph on the right shows the abuses and injuries experienced broken down by location of displacement. So we see that they tend to be the same top 4 across all these locations, but very high rates of witnessing death, physical violence, and robbery for those fleeing Al-Junaina and Al-Fashir. As mentioned before, also, sexual violence is incredibly high in Darfur. 75% of women and 54% of men reported experiencing sexual violence somewhere along their journey. So it's a very difficult, dangerous route on the way to Chad. Since we do have the stopping data, it would be very important and useful to provide access to services and information in these locations, so including basic emergency services, but also really psychosocial support, looking at what people are experiencing. As Isla mentioned, we also know that they are talking to family members about safe locations, and so really tapping into that network to provide better access to information. Okay, so this is a slightly different data collection that we do. It's called our longitudinal data collection, and this is where we follow up with the same respondents 3 to 6 months later. So the data that we have up here is from Sudan in late 2023, where we spoke to most of these people in August and then have consistently followed up with them since then. This is a bit of a snapshot of that data. And of these respondents, we see that nearly half haven't moved. They're still in Sudan. About 10% have moved within Sudan, and another nearly half have moved out of Sudan to surrounding countries, which you see on the map on the bottom left. For those who are still in Sudan, we know that most plan to move to either Egypt or Libya, and they cite that this is because of a lack of safety. So our longitudinal data is really confirming our panel data on the connection between safety and movement intentions. We also see on the bottom donut charts that there's still considerable movements being planned. Even those who've already left Sudan or moved to initial safe locations within Sudan say that they plan to move within the next 3 months. So a lot of the mixed migration dynamics linked to the conflict is still unfolding, and it's important as a part of the response that we're equally as dynamic and comprehensive. Thank you.
Thanks so much, Lavina. Next, we'll move to Harry. Thanks.
Do I find it? Here we go. Okay.
Can you see yours? Yeah.
Thanks. There we go. Okay, nice. Okay, so I'm going to be talking primarily about the internal displacement situation and also non-Sudanese nationals in mixed migration flows to neighboring countries. A lot of this information will come from this recent mobility overview report, which I will discuss with the organizer if we can make that available. That was just released in November. So this is the historic displacement timeline. As you can see, it is going further back to the current crisis, and it's important to recognize that there are a lot of, there was a pre-existing internal displacement situation that was already protracted and long-standing before the most recent events. And we've heard already some of the main numbers, but it doesn't hurt to recap. But as of this month, we have over 11 million IDPs in the country, so obviously that's more than the population of London, internally displaced in the country, and nearly 2.5 million households. Sudan is the biggest displacement crisis currently. Approximately one in 6 IDPs in the world is Sudanese. And whether we say it's 1 in 4 or 1 in 3 of Sudanese being forcibly displaced, I mean, it's about 30%. I mean, it's a huge number, of course. And the other thing that's important to take note of, I think, is that the conflict is both being driven by and also exacerbates other sources of fragility, including some of the natural hazards that have affected the country. I mean, we've had 200,000 people forcibly displaced also due to flooding in recent displacement cycles as well. And so this is just another look at the same kind of figures. So you can see, of those displaced prior to April 2023, that's also making up a significant cohort in those who are currently also being displaced, a second or maybe even third time as part of the crisis. And again, also the floods, half of those people affected were already in displacement situations. So of course this is creating, really exacerbating vulnerabilities and is a risk multiplier. This is just a very brief overview of where those who are displaced in the country have come from in orange. So a lot of it is of course kind of urban centers, and where some of those places are in Sudan that are hosting the most IDPs, which is in the blue. So just, a couple of things. Firstly, obviously this is a national crisis and displacement is widespread, but there are, of course, specific localities where we have far higher than average concentration. We have maybe sort of 15% of the population are IDPs. For example, in Darfur and also Gadaref as well. As has already been mentioned, so I won't go too far into this. There is a bit of a gender kind of skew. Most IDPs are female, half of them are children, around a third of them are girls. This is some recent data from the multi-sectoral needs assessment that was published, I think, a couple of months ago. Just to give an idea of what some of the main needs are. So this is top 3 needs reported by households, and this is a nationally representative survey. But as you can see, famine is really by far and away the biggest issue. And 97% of IDPs are in localities with very high levels of acute food insecurity. So that's IPC level 3 and above. There are also many localities and specific camps that are IPC 5 and above, and really sort of extremely severe risk of famine. Other key areas here, lack of access to health services, water as well, and livelihoods, of course. These are a couple of other key indicators from the same assessment. Basically, as you can see, there are many IDPs and many IDP sites basically reporting that people are not able to find work, not able to access enough water, have sanitation problems, don't have access to basics like soap. There are only, we're looking at between 10 and 20% of the IDP populations that haven't experienced children that have dropped out of school as a result of the crisis. So that's obviously storing up a lot of issues in future as well. This, as I mentioned, the most severe hunger levels. There are a couple of a couple of regions that are over 20% there as well. And the levels of psychological distress are, of course, extremely high too. So these are data from the movement intentions for the next 3 to 6 months amongst IDPs. You can see that the vast majority, so yeah, nearly 2/3 are reporting that they intend to stay in their current locations. Yeah, around about 14% returning to their location of origin. Some moving to another location, some undecided, and some also, of course, leaving Sudan to another country. And those reported destinations are, intended destinations are following the broad patterns that we still see in the neighboring countries as well, which I'll come on to. But Egypt, of course, is the top destination, followed by Chad and South Sudan, but also Libya, Uganda, the Gulf, and there's quite a long kind of tail there as well. So those who want to, the reasons reported for moving, just to briefly go into this, I think it's important. So usually the security situation is kind of sufficient for those who would like to stay. I think what's kind of concerning those who are returning to location of origin, the largest reported reason is because they basically run out of resources. So essentially kind of caught between a rock and a hard place. And that indicates, you know, situations of pretty extreme vulnerability potentially as well. A lot of the people who are moving to a third location in South Sudan, it is due to security reasons and also again to resources and services. And those who are leaving Sudan to other countries reported that they think that basically they have a better chance of making a life elsewhere at this point. So this is the cross-border, these are the cross-border migration flows, comprising both Sudanese nationals and non-Sudanese nationals. I'll let Stefan talk about the Sudanese nationals, but you can see that there's quite a big amount of variation here. But we have, sorry, there's a Teams chat on here. But we have, for example, you know, high levels of returnees in some of these countries, such as South Sudan, where it's actually kind of, you know, the majority of the people coming to South Sudan are South Sudanese. On the other hand, Egypt, you know, the vast majority are Sudanese. So it's quite a mixed picture. Oops, sorry. And this is this is also another way of kind of illustrating the rise since the start of the crisis, where we're at now over 3 million who have actually crossed borders, and this is the breakdown of the non-Sudanese nationals who have basically fled to neighboring countries. So of course these irregular cross-border migration flows are, you know, give us grave concern for the different protection risks that people have. Many of the people arrive, you know, completely exhausted, in vulnerable conditions, having been separated from family members, highly traumatized, potentially have been at risk of, you know, abuse, extortion, as well, exploitation even. And people are often arriving in kind of remote and underserved areas and facing high levels of, you know, some of the same issues and needs drivers, malnutrition and food insecurity, and vulnerability to other shocks, such as flooding. We also have had some reports of some forced deportation and pushback as well, for people that have tried to kind of go back and forth. Yeah, so I think I'll stop there. I'm probably at time, but happy to go into any questions. Thank you.
Thanks so much, Harry. I think that, again, really highlights the importance of thinking about secondary displacement and this compounded nature of the crises that people are experiencing before they cross the borders and the vulnerabilities that are layered on top of existing ones. And this is a nice segue into Stefan's presentation, which I think picks up on this cross-border movement.
Morning, colleagues. Very happy to be here to be talking on the forced displacement in relation to the Sudan situation and the displacement in the neighboring countries. So first, this slide shows about the forcibly displaced from Sudan since the conflict in April 2023. As mentioned by Ari, there were 8.4 million IDPs, 676 refugees that have refugee returnees, and 2.4 million newly arrived refugee and asylum seekers. If we go into the breakdown, you have 716,000 arrival in Chad, and as mentioned in the previous session, 200,000 are close to the near border in Adra. We have 1.2 million arrival in Egypt, mainly in urban area with major humanitarian needs. We have 100,000 displaced that arrived in South Sudan, majority with 650 being refugee returnees. We have 180,000 displaced into Libya, out of which 120,000 at the border without necessarily access from major humanitarian partners. We have 36,000 that arrived in Central African Republic, of which 15,000 have been able to be reached in Kosti. And finally, we note also a steady increase in terms of displacement into Uganda, with a sharper increase of new arrival in 2024, with 61,000 today. Which brings, as mentioned earlier, the total forcibly displaced in the Sudan situation to 16.5 million people. That's 11.2 million IDPs and 3.4 Sudanese refugees outside Sudan, which account to the number that we've been referring to as 30% or 1 out of 4 Sudanese is forcibly displaced. We have also 0.9 refugees inside Sudan, out of which, like mentioned, many of them have been in refugee for more than 20 years in Sudan, and 300,000 have, since the conflict, relocated within Sudan. Some interesting facts about the refugees inside Sudan. We're talking about the majority being South Sudanese with 72%, 16% Eritrean. 48.6% of those refugees are in White Nile state, of which 68 in settled camp and 38% out of camp. When it comes to the refugees outside Sudan, or what we talk about the displacement outside Sudan, the majority of the displacement outside Sudan is in Chad with 1.3 million. Majority of them being refugees, but we also note 209,000 returnees, followed by Egypt with 1.2 million, nearly 1.3. Then South Sudan with 1.1 million, among which 650, as I mentioned earlier, are returnees. And followed by Uganda with 61,000, Ethiopia with 50,000, and Central African Republic with 30,000. This map or this graph shows the registration database within the neighboring country with Sudan. As you can see, you have the total refugees entered, but also give you a progress in terms of how many of them have been registered. you see that the ratio actually like varies from country to country. There are, of course, many reasons for this. Like one could be the access, like hard to reach, far to reach, like in Libya, Central African Republic, and also in Egypt. There are also some of the refugees or the Sudanese refugees that have like alternative, like permit, legal option to stay. So they don't necessarily come to register with UNHCR, but regardless, they are still in need of international protection. When we noted the onward movement, like in the sense of population, registered refugee population that are moving onwards, in total we noted that there was 13,000 Sudanese who moved onwards. Out of these 13,000, 10,000 are movement within the neighboring country. And the movers are primarily like the top countries where they're moving from South Sudan and Egypt, with respectively 5,000 and 3,000. And the top two countries where they're moving to is Uganda, Libya, with 4,000 and 3,000. You can also see, of course, people moving into also Egypt, which makes Egypt both like receiving and moving from. Some statistics about the refugee population that have been registered. Important to note that 79% of the populations are women and children, the highest being in Chad with 87% of the population registered, followed by Central African Republic with 86%. We have lower proportion noted in Libya and Ethiopia with respectively 43% and 37%. Another interesting fact also, out of the refugee population, 650,000 are school-aged children, which account to roughly 35% of the population. And if we want to link this in relation to education data, there's also refugees with a higher education tend to relocate to countries that offer more opportunities. So we see, for instance, that in Uganda, in Egypt, and in Libya, you have respectively 30%, 24%, and 20% of the population with a higher education. Conversely, like if you look into Chad, and South Sudan, you have 65, 55%, and 49%. Thank you.
Thanks very much, Stefan. We will come back to a question around potential gaps in this data and how they could be addressed. But as somebody who works on Eritrea, there is a notable gap there in the total in neighboring countries in terms of, I guess, capacity to be able to do research into the dynamics that are happening there. So I'll pass over to Angeliki and Harriet.
Thanks. Hi. I apologize in advance. I just returned from the border and I appear to have left my glasses somewhere on the route, so I'm not scowling at you. I genuinely can't see. So let's hope for the best. We wanted to, Angeliki and I wanted to present this morning some of the protection monitoring data that we've been able to pull together across the different areas of operation that we're working in. We have developed an interactive dashboard with kind of pulling together some of those key protection risks. We are doing some protection monitoring in South Sudan, in Chad, and Angeliki will speak to the pieces that she's doing onwards in Libya as well. And we are trying to pull all of that information together to give us a more kind of rounded and holistic picture about the broader protection environment that we're operating in, but also what that now means to the humanitarian response and in the way that we need to be working to be most effective and critically to reach hard-to-reach populations, not just where they are physically hard to reach, but where our services are hard for them to reach because they are vulnerable and marginalized in different protection ways. So this is also sort of kind of coming together to kind of form a few kind of key advocacy areas for us to pull out. And here we've been able to put together both the protection piece and the MMC piece. So we're looking at both the movement trends and also how those link to some of the protection trends and protection violations that we're seeing on the route. This year we've pulled together, and I think it's around 7,000 different types of interviews, whether it's households, key informant, or all the work that MMC is doing. Here is some of the data. It's an interactive dashboard, so you can go deep dive into kind of what does this, you can click on the pie charts and click on the different kind of bars and really delve into what do some of these things mean. Of course, one of the major challenges is that in the different countries, the different, slightly different protection monitoring questions are being asked. They're not asking exactly the same questions, nor asking exactly the same questions in exactly the same way. So we've had to be quite kind of imaginative about extrapolating like-for-like data and being able to put that together. But broadly speaking, we can see a lot of the data that corresponds here with the trends, and the pie mapping there demonstrates where it is that we're gathering that data from both protection and the MMC side. Here we're trying to look at kind of linking population movements to the kind of human rights violations. So where we see rights violations being peaking, we see a corresponding kind of movement. It surprises nobody. I think that the critical drivers, conflict and humanitarian needs, but delving deeper into that data helps us to understand what kind of humanitarian needs people are seeking support for, and where there is an insufficiency in that humanitarian service provision that speaks to what we should all be doing differently or how we should all be working differently. There was a couple of things to kind of talk about here, looking at the corresponding kind of peaks internally within Sudan, so April and October, and then cross-border peaks in July and September. And those help us to kind of better plan year on year for those kind of surges. Angelique, going to come in on this one?
Thank you, Harriet. I hope you can hear me. So I'm the protection manager from Tennis Refugee Council for Algeria, Libya, and Tunisia. I will present our protection monitoring data from the beginning of this year until Friday, practically, focusing a little bit more on Libya side, where we have been conducting protection monitoring since 2020. In the beginning of this year, we actually started conducting cross-border protection monitoring with Tunisia, because we have seen population movements between the two countries. So, as you can see, we had 217 interviews in Libya, a very small number in Tunisia due to different reasons, also the fact that we just started. And just to say that the focus of today mainly will be on Libya. At the moment, and building a little bit more on the data that was shared by our colleagues from MMC, IOM, and UNHCR, we have at the moment over 180,000 Sudanese in Libya. Some of them have been there for a long period of time. Some of them are new arrivals. At the moment, we observe 400 to 500 arrivals daily, entering from the south of the country where it's minimum service provision, and then moving towards the coastal side, and mainly Tripoli, where it's the only area that can be registered with UNHCR. We have a lot of population movements, obviously, within Libya, and we know also from the past and from other data collected by MMC that it's not a safe route for people to take. So one very important thing to mention about the context is that Libya is not a signatory state to the 1951 Refugee Convention. That means there's not a possibility for someone to ask officially for asylum, and therefore not have the international protection that some of the Sudanese population at least will require. The same applies for Tunisia. It is a signatory state, but there is not national refugee asylum law. And obviously, we have a vacuum in both countries where refugees cannot claim their rights. They cannot access justice. So it's our stand as DRC is that both countries are unsafe for refugees to arrive to. Yeah? We haven't seen a huge population movement towards Europe yet, but this is a rather new crisis for Libya. So we don't know how this will unfold in the future. I think some recent IOM data picked up movements of Sudanese towards Europe. So maybe we can change. Thanks so much, Hayat, for supporting.
So what we're finding in the data, and some important things to pick through, and this corresponds with what others have said, is the top risks in Sudan looking around GBV, trafficking, forced labor, discrimination, access to and legal barriers. When we delve a little bit deeper into that, what people are saying about GBV is not only that those risks are extremely high, we're seeing a significant uptick in forced marriage as a coping mechanism. We're seeing extreme peaks in the data in Gudaref, West Nile, Central Darfur, South Kordofan, particularly closer to the border crossings and to the border areas. We are seeing this come up as the primary risk during the movement peaks and during kind of actual displacement and actual movement, rather than kind of in static locations, or as well as static locations, but as the primary risk. And see kind of recurrent kind of theme of very little, if any, GBV services. And we've also talked about mental health, psychosocial support, a real gap in mental health and psychosocial support services to support survivors. Trafficking and forced labor is a kind of the, global protection category under which protection monitoring is done, but primarily what we see in there is that this is really about labor. This is really about forced and harmful labor. This is both adults and children, with a very significant percentage of children being reported as part of this. And that links back to a point around livelihoods that came up in Harry's presentation, where perhaps as humanitarian actors, and particularly in early phase emergency responses, we don't see economic recovery and livelihoods activity necessarily as life-saving, but the information that we're receiving in the protection monitoring and that IOM also have is that this is actually not, not the case. We need to rethink the way that we think about economic recovery and livelihood self-reliance activities in these early stages of responses, because we are finding that the underlying root causes of some of the protection risks are actually linked to livelihoods and a need to supplement limited humanitarian aid. Particularly around the legal identity barriers. In many locations, people are reporting challenges in receiving humanitarian aid because they don't have ID, cards or any form of ID. In Chad, similar areas here, and there is a separate section here to follow up specifically on child protection risks. And if I can just move on to the next one, here, this rainbow graph at the bottom here, this multicolored piece. Here is where we're able to pick out some of these categories and their kind of movements across the timeline across the year. The dark blue there, for example, is people. Oh yes, sorry. Yes. is the point that is the impediments and restrictions that we were talking about. There is also a color that appears to, yes? think it's purple, plum, on the presence of mine and unexploded ordnances. And we can see a relatively steady reporting of that, around 10% of people who are encountering and noting the presence of mines and unexploded ordnances on the journeys, which is something I think is critically underreported and under-discussed in this crisis particularly. And we also see kind of those prevailing top level issues, trafficking in persons and forced labor in yellow, as I mentioned, and a color that appears to be around peach on discrimination and stigmatization when people are trying to access services. So a lot of the data in there when we picked through it was around barriers and discrimination of certain ethnicities, of gender or age, discrimination when people are trying to access humanitarian services. So a piece there about about how we need to work as humanitarian actors. The other thing that we're able to do with the reporting, one of many things that we're able to do with it, but is also to look at the intensity of the risk reporting. So in some areas we see that an average of 1 or 2 protection risks are reported. And in other areas, we see that an average of 6 or 7 protection risks are reported. And for example, in Unity State, or one area of Unity State, the level of reporting is an average of 9. And this gives us a kind of a roadmap into further needs assessments to make sure that we're targeting and kind of sufficiently surging our protection support into the most affected areas, broken down, more precisely across counties and states.
And going a little bit more into Libya and Tunisia, and building on what Harriet mentioned so far, we see extremely high levels of discrimination. I would say that more than half, it's around 65% in Libya, and almost all in Tunisia report discrimination. Also in terms of accessing services, as I think Harriet mentioned as well, the psychosocial impact of this is extremely high across all people that have been interviewed, and obviously this affects their access to employment. Harriet mentioned as well, in terms of access to essential services, civil documentation seems to be the main reason. Lack of access to civil documentation seems to be the main reason for people not being able to access services. You see the percentages are really high, with health being the most inaccessible service, followed by education and other protection services, including mental health and psychosocial support. And just to say that in Libya, especially because there is not the possibility to be registered as a refugee and ask asylum, a passport is the most protective document a person might have. The refugee card that UNHCR provides is not recognized by the government or the armed groups. So access to a passport is the only thing that provides some type of protection to people against arbitrary arrest, detention, and other forms of exploitation. And you can see as well the consequences of not having these documents. Obviously, as we said, it is the access to essential services, their ability to move freely, as well as potential deportations. I will go very quickly through some of the conclusions that we make. We see we have a similar trend analysis as well, with risks picking up in the last months. And just to say that there are very high percentages in terms of physical abuse and verbal abuse across the 2 countries, and obviously sexual abuse predominantly affecting women. I think we can move to the next, and we can share some of those a little bit later. But if we want to draw some conclusions based on the presentation from East Africa and the Great Lakes, as well as from Libya, we can say that this is definitely a cross-border, cross-regional and protracted crisis at the moment. And I think everyone already spoke about the interconnected displacement drivers. We have people that move for different reasons, and this is something to take into consideration when we provide response. But also, at least in Libya, but I guess it's the same in the East African countries as well, the gap in response is really, really worrying when we put into perspective with the needs that we see and the sense of safety. colleagues before mentioned that as well. As well as the psychosocial impact, right? People have been going through multiple risks. They have been presented by everyone so far. So I think it's really, really important to consider that, especially for us, when we see people potentially in the end of their journey, we see people that have been traumatized a number of times and from a number of situations in the past. So this is something considerable, I think, when we have to discuss about potential funding, potential responses, and a little bit more sustainability of the work that we do. One thing also to consider in this very difficult environment, the high levels of discrimination doesn't make our work easier, right? And I will hand back over to Harriet only for some basic recommendations.
Thanks. And I think, I mean, one of the critical recommendations here is around taking a cross-border or a sub-regional lens to the crisis, looking more broadly at displacement axes and kind of taking a bird's-eye view to this, and the importance of that. And the different areas that need to be emphasized there, a continuation of services and a continuation of availability and quality of services across displacement routes, recognizing that that many of the violations, protection violations that we're seeing and that are being reported are happening during movement, and as well as in static locations, but it's much higher in during movement, and making sure that we're recognizing that that it is not that people need to come to centralized locations to receive services, but they need to also receive services along those common routes. The importance of integrating child protection services. I think I've talked a little bit also about the importance of integrating economic recovery and self-reliance services, recognizing that many people are resorting to significantly harmful practices to supplement what limited humanitarian aid is being provided. I've been told to stop. I shall do so.
So I'm going to open the questions. The first one is about where do you see gaps, major gaps in the data that you've collected, and what are the priority areas for addressing that moving forward over the next, let's say 6 months to a year. What are the key takeaways in terms of implications for humanitarian programming? And that's something that Harriet and Angeliki have obviously just touched upon, but maybe our other three presenters could hone in a bit more on that. Noting as well, I think that Stefan really pulled out of the data how heterogeneous the demographics of the different populations are. If we just take education level, the implications of the fact that you've got 55% university educated individuals crossing into one country, versus a majority of primary educated individuals crossing elsewhere. Obviously that has big implications, but if there are some key takeaways in terms of implications for humanitarian programming, that would be great. And then my third question is, you all presented these critical snapshots over the past year, 18 months, in terms of these displacement dynamics, but you've obviously got longer term monitoring of these situations as well. So I just wondered, are there any lessons that we can take from your kind of sustained protection monitoring of displacement from Sudan? Because it's come up in this panel and it obviously came up in this morning's discussion that this is an acute crisis, but it has a long history as well, from which we might be able to learn lessons to kind of inform programming going forwards. So you can pick kind of which of those questions to focus in on, but maybe we'll move down the line and start with you, Stefan.
So I get to choose first. Let me start maybe on the main gap, but I think we can be all conscious that there is a lot of needs of information, like a lot of analysis required to be able to make like sound decision, to be also able to understand the situation better. And it's not a one-side profile. Like at minimum, like I think based on our presentation, we've seen like how diverse the different groups are. So At the same time, funding is very low in the sense that it's very difficult for most of the operations. There are a lot of needs. So data collection is also something that is quite expensive, that takes a lot of resources. So I think one of the key gaps is looking at actually all the presentation is how we come up with an analysis that I can actually speak to each other and give more evidence on the actual situation on the ground. That would allow us for once to be also a bit more efficient in terms of the data that we collect. We cannot be collecting all of the same data in the neighboring countries in all of the different situations. Key takeaways, and I mentioned some of them earlier in my presentation. 87% of 79, of the population are women and children. So of course, intervention for guaranteeing their safety and the security is important. We talked about school-age children, but also the fact that depending on their higher level, they choose different options. So there's a lot to be done, 650,000 in terms of education and programming, maintaining the curriculum. I think if I give you a breakdown in terms of the different school, the curriculum, we have 25% who are with the primary school level. We have 19% who have with the secondary education, and we have a 9% with the university completed. The remaining 41 without any education recorded. So definitely something to look into. And access to basic services. In most countries, there are a lot of challenges. Existing services are already stretched. Many of the displaced population are still at the border without access to those services. So that would be from my perspective, the key things.
Go on. Yeah. Yeah, on the data gaps, I would fully agree with you, Stefan, that we should indeed aim to have more joint analysis, and particularly around protection issues, including in the internal displacement settings. Obviously, this is the kind of context where it's very difficult, and that's why I commend our colleagues on the protection data that they're able to present today to address this in a sort of with a sort of quant approach. But of course, there are many ways of looking at risk and protective factors that are predictors of vulnerability that don't include the same kind of risk of harm, and that's definitely something that we should be aiming to do more of as well. I would say, indeed, scaling up protection monitoring across the board also makes a great deal of sense at the moment, particularly given the kind of the dynamic situation on the ground, and the fact that we, again, it's difficult to put in place the kind of safeguards that we would need to go beyond that in many contexts. And there's a lot that we can probably operationalize from teams on the ground that probably isn't being shared as effectively as it could be. I think on the neighboring countries, there's a real need to, I mean, this goes hand in hand a bit with fully integrating those communities in the entire response. But I mean, many of these people who have crossed borders are now in essentially camp-like situations. The data that I presented is mainly kind of taking data as people are moving and arriving, crossing the border and so on, but there's a real need to now sort of establish baseline data on the numbers, the vulnerabilities of these populations, and to inform the programming there as well. I think for lessons learned, I don't know if we necessarily need to look at Sudan specifically for this, because I mean, there are also many recent and nearby kind of crises where we can already learn some quite basic lessons, I think. So one around, for example, trafficking and forced labor, and I was very sort of pleased to see that that was focus of the data collection and reporting from DRC. But we know from many other contexts that the prevalence of these kind of abuses is extremely high. We've been able to produce research on this in the past, for example, in South Sudan, DRC, and Northeast Nigeria, with ILO and Walk Free Foundation, looking at the prevalence of forced labor, forced recruitment, and abduction, for example. Yeah, hold it up here, maybe. Sorry. This is actually, yeah, I mean, in some cases more, at least more than 10 times higher than the global average. Sometimes even more like, 100 times higher. I mean, the global average is obviously, it's a rare event, but it really, really is not in these kind of contexts. And of course, we understand why. More vulnerabilities, greater prevalence of risk factors, diminished capacity of duty bearers to be able to respond, and of course, just more likely to have perpetrators being able to act with impunity. But I think also it makes a lot of sense to look at livelihoods from this perspective as well, where people also fall into situations where they have, not the best livelihood strategies, let's say, and sometimes, unfortunately, that can involve violating others' human rights. So I think we have a lot of evidence that's already there to draw upon in these, in similar kinds of contexts, and we don't necessarily need to, put all the emphasis on the Sudan response to be able to provide that. Also on the Syrian crisis, we also, now the numbers are kind of broadly comparable, looking at, those who moved into neighboring countries and how we weren't able to effectively address, all of those needs, and we did end up also with basically a big increase in irregular migration, organized criminality. Maybe in some sense we still have some of that legacy in the surrounding region in any case, and if we're not able to adequately address the needs of those populations in surrounding countries as well, then we're kind of storing up some of the same risks and problems potentially. I'll leave it there. I've been speaking a long time. Implications for programming, maybe we can come back to.
Hello, you can hear me? Great. So I'll keep mine short so we also have time for questions. I think echoing what they said in terms of coordinating our data and analysis, but also really having humanitarian actors actually use the data. We have so much data as we just presented, and having actors on the ground really adapt their work to what we're saying and what we're saying that we see on the ground. So I think that first and foremost. In terms of gaps in data and priority over the next 6 months to a year, I think the impact on children in this crisis specifically, we're seeing that women and children tend to be the majority of migrants and refugees, and really understanding the long-term impacts of that. So not only on education, as we mentioned in the previous panel, but also even just the need for food that you mentioned, the impact on their health, right, and how that will change long-term. So really, delving into that, I think, would be important. And then the third point on, again, a takeaway for humanitarian programming is that despite the war, migration isn't stopping. We still see Sudan as a major transit country. We're still seeing Ethiopians and Eritreans, especially in transit in Sudan, and really adapting our programming for these third country nationals because they are incredibly vulnerable. And they're still choosing to migrate through a war-torn country, right? Okay, I will keep it there.
Hello. I think just to add on the gaps in the data, I think we talked about this in the first session a little bit, but the connectivity and potential digital solutions that we could employ that obviously cost more, but if we had adequate connectivity, and we were able to kind of employ some slightly different and innovative digital solutions, we would have more data, it would be more real time, and we would be able to do more with it, including sharing a bit more. I think the point about the interagency nature of protection monitoring and making it much better coordinated and much better shared. I know we were just talking over coffee break or this morning, and I know that NRC are also doing some protection monitoring in some of the areas that DRC is also doing it. Putting that together only serves to enrich the data that's available for everybody. So I think the next phase is about getting a bit better coordinated and a bit more interagency lens on the protection monitoring data, rather than having each agency sort of doing their own thing and kind of asking questions in slightly different ways and with slightly different frequency. So being a bit more willing to share. I think on the takeaways for the humanitarian programming, it's about using the data to be much more targeted, much more adapted, not just to the needs, but to the areas where we can work. So, for example, if a WASH actor is coming in to do WASH programming in an area where they know that the prevalence of GBV risks is extremely high comparative to other areas, they know that they have to build in a protection lens in the design of WASH facilities, and build in perhaps also some protection questions within their needs analysis. They can be much more kind of tailored and adapted to the context, taking this data and knowing where those kinds of kind of higher risks are going to be. And it just, I mean, that's one example, but there are many that we can think of. So I think that's the key takeaway from our side, and the way that we use the protection monitoring most keenly in our work is kind of better targeting and adapting. And really in a context where the resources are far outstripped by the needs, we should be better able to kind of target with a kind of laser focus rather than a blanket approach. It should help us be much more efficient with limited resources. You asked a question a bit about taking the longer term data and looking at it over a broader period of time. There has been protection monitoring data done by various agencies going back as far as 2002, as far as I know. And so there is perhaps a piece of work there to be done from an interagency perspective. It wasn't ours, just to say, but I know that other agencies have been doing it. And perhaps there is an interagency piece of work there to layer the different years of protection monitoring data and look at and what that tells us over a 20-year period.
And just to add a little bit, we already mentioned how important it is to do an analysis across the different countries and understand what is really happening. But I would say that for me, as a practitioner as well, that the most important thing is to do a contextual analysis of the needs, right? The context is not the same across the countries, and I think this is the biggest lesson learned for us. The data from Sudan or from the other countries that refugees pass through is really important for us to predict potential movements and understand the impact, right, that those needs, that those risks had on the specific population. But in reality, because the context in our countries is completely different, we need to take this into consideration. And I would obviously focus more, and I would agree with Lavina, we don't need more data, we need more responses. And the responses are not coming. It's a very underfunded response overall. I think everyone will agree on that. We're speaking about millions of people being displaced, and still, at least in Libya, we received very minimum funding to be able to respond to the basic needs of the population. Yes, not even address, let's say, the psychosocial needs that we observe for everyone, including children, right? What seemed to work for us is a more community-based approach. So as you mentioned, there are a lot of well-educated people. So we managed to come across, for example, a group of Sudanese lawyers that are working together with us as a part of our legal aid programming as well, that facilitates access to civil documentation. We work closely with the Sudanese embassy as well. So we're doing joint information sessions on what the embassy can provide, how DRC can complement those services. As I said, civil documentation for us is one of the main priorities, at least for Libya, because it's what provides protection to the population, as well as psychosocial support, I would say. But it's also what protects people against refoulement. And we've seen refoulement happening in different borders across the different countries in North Africa. So I think it's really important to consider that for future programming. And the last thing is just taking advantage of small windows of opportunities. We saw changes, significant changes in the context of Libya from Libyan authorities towards Sudanese refugees. And this is a very, very good opportunity for us to consider doing something more.
Great, thank you. And I think you make a really important point there about also adopting a strengths-based approach and thinking about how within this community, as we discussed in that first panel, there's a lot of capacity that can also be tapped into to support these, to support programs. Thank you for these really detailed, thought-provoking presentations on the data.